Hello again and welcome back. I am Fred Earls with New Foundations and I'm the Director of Communication. On the other side of the screen over there, I guess, that is Dr. Sharon Brown, our CEO. And good afternoon, Dr. Sharon. How are you today?
Hello, Dr. Fred. I am doing well now that I'm recovering from my nice cold that I had or
The
whatever.
crud.
It
Yeah.
could, yeah. So
Yeah, I
I may
understand
still
that.
sound a little nasally, but I'm much better. Thank you.
Okay. Awesome.
Yeah.
So this is part two. You may remember to kind of refresh your memory over there. And we discussed ADD, ADHD, some similarities and differences. And then we discussed some criteria. We discussed onset of adult ADHD. Is that a real thing? That was
Mhm.
our second point. And in this video, which is the part two of the ADD, ADHD saga, as we might call it, uh, point number three. Okay. Are you ready?
I am ready. Are you ready, Fred?
Hey, I am ready.
All
So,
right.
is ADD slash ADHD, is it over diagnosed?
So, in my opinion, yes.
Okay.
Um, I feel like that we as in psychiatrists, doctors, counselors, people who places diagnosis on people, um, we kind of go through a trend to where, this is what we see. So this must be what it is. Um, I believe that ADD, ADHD has had a big trend for a while of being diagnosed. Um,
Are you saying it's a fad?
Can it be? Yes, I
I don't
think
know.
I believe it is.
Okay.
Because we've seen some increases in some other diagnoses as well. And again, if we meet certain criteria, oh, then it must be this. Um,
Okay. Let
I
me
would,
ask you this.
mhm.
So, let's just put a pause right here. You do have a PhD. You are a psychologist.
Yes.
How do you go about determining, okay, I have patient A with me and we're in a session. How do you go about determining this patient is or is not someone with ADHD?
Well, to determine a diagnosis, as I think we talked about in our last video, that we use a DSM, the Diagnostic and Statistical Manual of Mental
Okay.
Disorders. The DSM-5 is what we're in. I think we've got a new one that's coming out or has just come out. Um, but it has a list of all the mental health disorders and the criteria that meet those disorders. What we have to look for to see if that person meets that criteria.
Okay. So
Can
what
I?
you're saying, well, hold on. Let me ask you this question just
Okay.
to reiterate here. So what you're saying is you're not pulling this out of thin air.
No, we are not.
I mean,
It,
there are some set guidelines.
there's research. There are certain, yes, set guidelines that we're looking for, certain criteria, and so we have to look at that and determine, if someone fits all or what that criteria says.
Okay.
So can I follow that up though with a statement that I think that is important that we understand?
Okay.
And that is as a counselor, as a supervisor, um, I've supervised other counselors, and I tell them that to me, it is important to have the accurate diagnosis. It's important so that I guess that diagnosis leads our treatment. It tells us what we are doing. But I think the better that, I've been doing this for a number of years, and I think for me, a better understanding or a better explanation of that is not the diagnosis itself, but the criteria. What
Okay.
criteria are we treating? What are we looking at? What is it that this person needs? What I want us to see and what I want us to understand is, why do we have to have diagnosis? Why do we have to give, diagnoses, plural, um, to people? Why do we have to say, oh, well, we are treating you for ADD or ADHD or anxiety or depression or whatever?
Well, you
Why?
have to know what you're treating. That's the diagnosis. Without the diagnosis, you don't know what to treat.
But what if they come in here with some symptoms, but they don't meet all of the criteria for that diagnosis?
You're the doctor.
So
Okay, good question though. So what do you do?
we treat the symptoms.
Okay.
So do you see when it comes to a diagnosis, that's important for MDs who are prescribing medication,
Okay.
because you have different medications for different diagnoses, right?
Right.
So it's important for them to have some kind of idea of what diagnoses we're looking at. If someone has a ADHD diagnosis, we're probably going to start with looking at stimulants, right? If they
Okay.
have depression versus anxiety, and we'll get into that another session, but they're going to be looking more at a antidepressant versus an anti-anxiety. Now, a lot of those medications are together, but there's going to be different things that we're looking at. But for counselors in our realm, we're looking at the symptoms. If you're
Okay.
telling me that you're having a hard time concentrating, having a hard time uh, staying focused on things, having a hard time remembering what you went into the room for, um, what's going on with that? So is that, do I need to know, oh, we're dealing with ADHD, or do I need to know this person is having some trouble concentrating and a lot's going on in their head?
So you do consider a larger diagnosis,
We consider
obviously,
that,
but
yes,
it may not be the big diagnosis.
exactly, yes.
Okay.
Um, I do want to add also to why do we have to have diagnoses? Um, and this might be opening a can of worms that I may not be ready to get into yet. There may be some people out there that doesn't like my answer here. However, for our clients who have insurance and we bill insurance, we have to have a diagnosis.
Mm,
And that's kind of bothersome, because
sure.
then we are first visit, off the rip, that 1 hour assessment that you come into, we've got to put something in your chart so that we can bill your insurance.
Interesting.
And I've had clients, or I've heard people say, well, that person only saw me for an hour and they've already told me that I've got this, and this.
Yeah. Yeah. And now we
Unfortunately,
know why.
yeah, that is why, because insurance says that we have to do that to be able to get paid.
And let's let's make a short comparison here. It's not like a sprained ankle or a broken arm. I mean, it's not something that is necessarily definitive by looking and taking
Right.
an X-ray.
Right, exactly. Like, I think I've mentioned this before, mental health diagnoses are very subjective.
Okay.
Okay.
Yeah.
So um, maybe because I do what I do, I can go into an office and tell you whatever I want to tell you and get the diagnosis that I want to get. I mean, you can go on Dr. Google and look up the symptoms for ADHD, and unfortunately there are medication seekers out there, and we know that, and that's unfortunate.
Hmm.
But you can go in to see your doctor, and these are my symptoms. Can I get something to help me with this?
They're
And
not
so
letting the doctor be the doctor. They're telling the
they're
doctor what
telling
they
the doctor
want.
what, yes, basically,
Okay.
and so that's an issue,
Hmm.
so um I have people, come in and just, will tell me, this is what I have. And so without them, I guess, maybe knowing everything about what they're telling me they have, I will go into questions and ask them. Um,
Yeah. If it were only so simple, right? Just to
right,
rattle something off.
right. And so, a lot of times, and I guess this is what we've been talking about with the ADD and ADHD, the adult ADHD, people will come in and say, I have adult ADHD. Okay. Somebody has told them that, or somebody has diagnosed them with that, or they've self-diagnosed. And that's that. And they may be true. It may be true, it may
Right.
be a fact, but I want to know more about that. I'm going to ask you a series of questions about why you believe that you have adult ADHD.
So you may take that information as a starting point
Sure. Yes, absolutely.
and then follow the path of wherever it takes you.
Yeah. Yes, absolutely. And so, like that, let's say, for instance, somebody comes in with that statement saying that they have adult ADHD. I might ask them, so what are your symptoms? What is going on with you that tells me, or somebody has told you that you have adult ADHD? Okay. So
Okay.
they may rattle off some different things. So let me ask you, Fred. I'm going to ask you this, and I'll yeah, I'm putting you on the spot, Fred.
Okay. I'm game.
What happens to you? What are your behaviors? What do you feel like? What are your behaviors when you are overly stressed and anxious? What do you like?
Probably not very nice to be around. I feel very pressured. I
So
feel
irritable.
very, what did you say, irritable?
Irritable? Is that what you said? Not very nice to be around?
um, Maybe. I feel driven to accomplish something, a goal, whether that goal is the big goal or a part of another goal. I feel like I've got to do, X. Um,
So kind of like your motor's going and can't stop. You're kind of restless.
yeah, yeah, absolutely.
Okay. Anything else?
I need a nap. I
Okay.
mean, I feel like it's not the nap. It's that it's like overload.
Yeah.
And the only way to kind of calm the overload feeling down is to just go to the chair, go to the recliner, go lay down on the couch, on the bed, close my eyes for a little bit, and just kind of let the feeling pass away, so to speak.
All right. Just something to just slow that mind down a little bit. So,
Yeah,
mhm.
yeah.
And so with this nap, I hear you saying that. So if you are not able to get your nap, or you are not sleeping well at night for a few nights, how does that feel? What are your behaviors then? Are they
Not
different?
nice. I have to have the nap. Uh, Now,
Mm.
I've shortened, to be completely honest here, I've shortened my naps from 2 hours to about 15 to 20 minutes. So I do feel like I'm getting somewhere.
Yeah. So you're
If
getting
nothing
that.
else, yeah, if nothing else, I just felt guilty because I was wasting 2 hours of precious daylight, so to speak.
Right. Right. So, Fred, we talked about that because all of that right there could say, oh, adult ADHD, maybe some things going on there, forgetting, where you put your
Hmm.
glasses, what room they're in, or
That's
what
right.
you went into the room for, all those things that we've talked about before. And then these things, the irritability, the restlessness, like your motor's just going and can't shut off, those are all criteria, along with some others, for ADHD. Okay.
Okay. Okay.
But they're also symptoms for anxiety. Um, you know, it could be related to the fact that you're not sleeping well and you're not getting the adequate sleep. We talked, I think, in one of our earlier videos about our health and our mental health going hand in
Right.
hand. So, how
Right.
important sleep is and what that does when we don't get good sleep. So,
It creates another thing, just a lack of confidence on
mhm,
my part.
mhm. So you see how a lot of these things kind of go hand in hand. The one thing the biggest thing, because Fred, as you and I have talked, I work a lot with trauma.
Right.
Uh, I work a lot with, the childhood trauma. I work with adults who have experienced childhood traumas. I believe that a lot of us have experienced some sort of childhood trauma.
Okay.
Um, and while, a lot of us can cope and manage that trauma, um, I think that it does affect us in certain ways that we don't really realize. Sometimes, though, that trauma is overwhelming and it affects a lot of a person's life. Okay, so when we
Okay.
look at, we're talking about overdiagnosing just in general with ADHD.
Right.
When we see children, so some a child who who's still young, you know, with certain behaviors, we're so quick to jump on that they have ADHD. That they're misbehaving in classroom, they're talking a lot, and they're hyper vigilant, and they're can't seem to focus, and we're very, very quick to say ADHD, and that bothers me. I want people to understand that we need to start looking at what's going on in this child's life, what's going on at home, what's going on in their environment, what has happened to this child. Maybe not just currently, but what
Mm-hmm.
has happened. Like I said, a lot of my clients have had pretty significant trauma as a child,
Okay.
and so with that, we know that, for instance, a child, sexually abused child, will experience all these symptoms of ADHD. And so it's like, wow, are we looking at other things that maybe this child has encountered or dealt with, you know, or are we just saying they're misbehaving in class? Think
Mm-hmm.
about, this is another, I'm going to give this quick example, and I know we want to cut it shorter today than what we normally do, but I want to give this other quick example that I've worked with children who live in poverty.
Okay.
And I had this little guy who would come into our after school program and would just go to sleep. If he wasn't asleep, he was, excuse my language, but hell on wheels.
Mm-hmm.
And so it was like, Dr. Sharon, why is he acting this way? We can't get. I said, well, let's look at his home life. He lived in a house, an apartment with his family, but his family also had other family members in there. This
Mm.
poor child slept in the hallway. His pallet was in the hallway of their 2 or 3 bedroom
Wow.
apartment with
Okay.
multiple adults, multiple other children, adults who did not have to work during the daytime, so they were up at nighttime with this child trying to sleep and get ready to go to school the next day.
Mm-hmm. Yeah. Yeah.
So he's tired. He is sleepy. How do you think he is going to be when he goes to school, when he is at school, trying to work, trying to concentrate? It's not going to happen, you know.
And you
So
couple that with he may or may not have proper nutrition on top
exactly.
of being tired.
Well,
Now he's hungry.
yes, absolutely. Which, fortunately, I mean, our school systems now, you usually do provide a breakfast and a lunch,
That's right.
but that's all he gets.
Wow.
So yes, so we're having these magnitude of problems, but yet this child is labeled ADHD.
So it takes what I'm hearing you say, several things, but I think to kind of tone this one down, it takes more than just a few minutes to really determine what is going on with an individual. And
Right.
and it takes time for you to determine how you can help that individual, which is what you do.
Yes. Yes. Um, yes, it does take a lot of time, again, because of insurance purposes, we have to put some kind of label on them, which
Right.
is very sad. Thankfully, I don't do medications, so I'm not just throwing some medication at them to try to make them behave in class or whatever, which, I think is very, very harmful for the child to do. Um, but then, when we look at this example of this one child who lived in poverty, there's a bigger systemic problem there
Yeah.
that I don't know, it's almost out of my hands. Almost, it's a
Okay.
lot much larger than just me. I can work with the child, I can help him as he grows to learn certain skills and techniques to help him, but at the same time, it's like I said, it's the whole family system. It's the whole, I guess, the whole, like I said, a much larger system than what I can
Hmm.
do by myself. Um, but then if we do look at some of these symptoms being caused from trauma or other issues, stress, anxiety, we're seeing so much anxiety in our young people nowadays, that we can work with that a little bit better with that individual and help that child with that. Um, what I do want to say though, coming back to that adult ADHD, so I'm mentioning the children and all these other things that could be going on with the children, but what happens is when these children are experiencing traumatic events in their childhood, they are internalizing these events in a way that is going to form their belief system in the future. So
Yeah.
these things are becoming kind of, if you will, for my word, irrational. They're not
Okay.
true about that person,
Okay.
and we grow up to be adults who believe that we have to be perfect, that we have to be productive, that we have to be all these other things, and we're
Yes, I
telling
do.
ourselves, what was that word that you say you try not to use? We try
Failure.
failure, because
Yeah.
that's not a good word. That's not a positive word.
Right.
And so if we tell ourselves that we're not productive, so therefore we're failure, that started from way back when this trauma may have happened, and we continue to believe that. So unless we do something as adults to address this irrational belief about ourselves, we continue to have these symptoms that look like adult ADHD, that look like maybe anxiety, that maybe look like depression, all of the above. But, again, let's look at the symptoms and where are they stemming from. That's where I want to kind of, I guess, finish up with today, Fred. It's because I think that we need to really get to the root of the problem,
Okay.
understand, not just diagnose people with ADHD, adult ADHD, or whatever. Let's really look at the criteria. Let's look at where these symptoms are stemming from and treat that. That's what I suggest, whether it's ADHD, anxiety, PTSD, whatever it is. So
So,
that's what I'm thinking.
and so as always, you know, if someone thinks they need help, knows they need help,
Yes.
wants help, how can they contact New Foundations?
They can contact New Foundations by email, info at newfoundationsinc.com. They can call us at 229-412-3452, or come by our office, which is currently at 305 South West Street in Bainbridge, Georgia.
The website's on the screen,
Website. That was
New
the other one.
Foundation Inc.
So
Yeah,
the website. That's another
.com.
one.
That's right.
I figured there was something else. So I was trying to figure out what it was. So
That's right.
yes.
As always, I enjoy doing this, but I learn as well, and so I picture myself out watching this. So hey, thanks for informing me.
You are
um,
so welcome. I think that this is important. I think that people need to understand our mental health and working on the symptoms. Not let's get away. I think that's part of the stigma. We've talked about stigma, also.
hmm
The stigma is getting a diagnosis. Oh, I've got this or I've got that, and give me this medication or give me that medication, and let's get away from that. What's going on to keep you from having your best quality of life? And so
Okay.
that's what we want. Also want to mention, Dr. Fred, is to that they, people can also go to my website. There are a few other things on there that I do personally. I do speaking engagements, retreats. I do blogs. We're going to be working towards our podcast and different things. So that will be on my website, which is Dr. Sharon Brown, DrSharonBrown.com.
Awesome.
Yeah.
Okay. Until next time, you have a good week.
Thank you, Fred. You too.
And once again, this is New Foundations Inc. We're located in Bainbridge, Georgia. We are a nonprofit, and our goal is to help those who need a hand up in life. And we have Dr. Sharon Brown as a counselor, and we have other counselors as well. So do not hesitate. We talked about this before. Make the move to get the help if you need help. Mental health is help, and we are here to help you in as much as we can. So until next time, you have a great day, a great week, and we will see you again in the future. Bye-bye.